Hi there, Dr. Frank Johnson from Sports Medicine Ultrasound, here to demonstrate a lateral elbow PRP. So my preferred way of doing this is going across the table so I can see down the sort of the barrel of the needle, if you will. So this is the second PRP. The first one was 4 weeks ago, and the patient was quite sore for the first night. So it's my habit for lateral elbow and medial elbow, Achilles tendon, patellar tendon, to prescribe some narcotics. So Percocet, and it works great. You know, you wouldn't get your wisdom teeth cut out without having some Percocets on hand. And I do the same because I have had people say, you know, I went to the emergency room because the pain was so bad. And that's just not fair to the emergency room. It's not fair to the patient. I think you just go ahead and give them some medications unless they decline, you know. So I've already got a touch of anesthetic in here, but I'm just going to demonstrate that. So what we see up here is we see a central area of tendinosis.
So the first thing is bone, then there's some cartilage. Now what connects bone to bone is ligament. So believe it or not, the bottom of this area is ligament. Then here's a little central area that's sort of darker, that's tendinotic. Here's the remainder of the tendon. And then this is just a small amount of subdermal fat.
Here, and again, this is dilute anesthetic. It's 1 milliliter, 1% lidocaine, and 9 milliliters normal saline. There's some evidence to say that lidocaine in very strong quantities might decrease the effectiveness of the PRP. However, in 0.1%, expert opinion says it's not a factor at all, and it certainly takes the edge off the treatment when you do that. So you really want to sort of think about this as a sponge you want to fill up. So fill up every little bit of the sponge. We also want to do sort of a needle tenotomy where we're passing the needle back and forth several times. You see that little injury open up there. I like to go in short axis as well, so we can see the full tendon in short axis.
So this, of course, is bone. The next thing is ligament. Remember what's on the bone is ligament. Then this is the tendon in short axis.
And now you'll see the needle coming in out of plane, sort of filling up the sponge. So I always like to have 3 milliliters of PRP, and then we kind of put in as much as sort of the tendon will allow. And this tendon is fighting back. This is good. This is a tendon that's not bad, not that bad at all.
So of course, what do we got? We have bone, then there's the cartilage between it. What connects bone to bone is ligament, but then we see this darker area, and this is actually a tear in the radial collateral ligament. Now here is the tendon, and then there's this darker area of tendinosis higher up on the screen.
As some docs advocate also roughing up bone, getting pretty aggressive with it. I'm not in the habit of doing that because I think most people do pretty well with just the tendon treatment. Anyway, that's it.